Don't let this constant severe ankle pain due to arthritis hinder you from doing your routine activities. If your physician says medication and surgery are the only treatment options for ankle arthritis, hold on. Medica stem cells therapy in the UK may help in healing the ankle arthritis naturally by itself. Let us first understand the causes and symptoms of the ankle arthritis and see how regenerative cell treatment can be the right surgical alternative. What is ankle arthritis? Ankle arthritis occurs at the joint that connects the tibia, shin bone of the leg, and the talus, above the heel bone, called the tibia-talar joint. Ankle arthritis pain emerges at this point in your ankle. It greatly affects your quality of life by hindering your mobility. Ankle osteoarthritis is a degenerative joint disease where the articular cartilage helps in providing a cushion between the bones of the talocrural joint, starts to degenerate gradually. It will decrease the space between the joints, causing more friction. Ankle osteoarthritis may also occur in old age due to wear and tear of the cartilage from overuse. Osteoarthritis may also develop from a previous injury to the ankle that may damage the cartilage directly, leading to its gradual degradation indirectly. The symptoms of ankle arthritis include pain, inflammation, and stiffness in one or group of small joints in the foot and ankle. This recurrent friction between the bones due to degraded cartilage leads to restricted flexibility and irritable swelling of the joints. Treatment of ankle arthritis. The conventional treatment methods, including RICE, rest, ice therapy, compression, and elevation, formula, mostly focus on treating the symptoms of the disease only. Administration of non-steroidal anti-inflammatory medication and corticosteroid injections reduce pain and inflammation. But they develop many side effects on being used for a longer period. Removing the damaged cartilage by surgery is the last resort. But it is painful and invasive. It does not restore the damaged cartilage or tissues. Hence, all these methods are considered as temporary. Regenerative cell treatment. When it comes to regenerative cell therapy, it treats the symptoms and cures the disease at the damaged site. It enhances the healing mechanism at the site of damaged tissues and reduces the symptoms such as pain and inflammation. This non-surgical method is minimally invasive, involving only local anesthesia. Regenerative cell treatment for ankle arthritis includes platelet-rich plasma (PRP) therapy that involves injecting platelets from the patient's own blood to enhance the healing mechanism. Another treatment for ankle arthritis includes Medica stem cells therapy in the UK. Here, the cells are harvested from your own body and are injected at the site of damage. These cells grow and differentiate into specific types of cells required at the damaged site. Compared to conventional methods, the regenerative cell therapy has no risks of rejection, infection, or an allergic reaction. It is because the physician uses cells from the patient's own body. Hence, this regenerative treatment is safe, and patients can return to regular activity much faster.